Dental implants are for anybody that is missing teeth. Simple as that. You don't have a tooth, you want a tooth, you get a dental implant.
I think that nowadays it is ideal for implants to be placed in areas where 10 years ago it was not ideal. There's more candidates now than a few years ago, you know. Also, I think a candidate has to understand the process of an implant. They have to understand the steps in which biology works to integrate an implant to the mouth.
When you lose a tooth, all the other teeth are gonna make the work of that tooth that is not in your mouth. So everybody's gonna suffer. So you have to replace it because he has a job to do.
Because when you pull out a tooth, the tooth starts to move, and this can affect when they bite or when they eat, and they will have a lot of problems in the future.
The first strip patient comes in, we sit down, we talk for a long time about what you do, what you don't do, what you've done correctly with your mouth and incorrectly with your mouth. You have to get this communication going with the patient to realize what the root of the problem really is.
After our evaluation, the first thing we are going to do is a CBCT scan. With this type of study, we are going to be able to see how much bone we have available in height and width. And that's one of the most important things that we have to evaluate on this first CBCT.
If the person doesn't have enough bone, we have many options to replace or to put an implant. Sometimes the first thing we need to do is a bone graft, growing back again the bone. We have the sinus lift. It's a procedure to push up the membrane of the sinus and fill it with bone. After that, we need to wait 5 to 6 months and then put the implant in place.
First, we're going to place the implant into the bone. We have to drill the bone and screw the implant, and then after a few days, start the stage of the osseointegration.
That means that the bone around the implant is going to grow, it's going to calcify correctly, and the implant is going to be part of the bone.
So the biological process of your body accepting the implant is known to take around 3 to 6 months. There's going to be certain things that we're going to request of you to do or to be careful with while you heal, whether it's smoking, whether it's not eating hard things, keeping a soft diet.
I think they have to observe the way that the implant is healing. You know, be real with your doctors. You don't want to hide things from them. You know, we're in this together and you are part of the team too. So you as a patient have to communicate realistically.
In the first appointment, when we make the implant placement, we can put a temporary crown or temporary abutment. Then the next appointment, we unscrew that healing cap and take the impression in order to send to the lab to make the final crown.
There is different process to make a crown looks good. First, the best material, and then the best technician. That's the most important artistic part on the job, because we will be creating what is something natural from the things that are synthetic. So that requires a lot of art.
When we put a dental implant, we have to take care, like if it's a normal tooth. You have to brush, you have to take care of them, you have to go to the dentist to see if it's going okay. You have to take care of them.
Normally it's going to be very close to a regular tooth. Only we recommend not to bite anything so strong, but I always tell the patients it's a common sense situation, you know. You have to understand that no matter we use best materials, best technologies, we are trying to imitate something natural, but you have to take certain amount of care about.
If the patient has hygiene and good habits, and if he clenches the teeth, he uses the night guard, it's gonna be a long-term treatment.
Yeah, so when we're finally done with an implant case, whether it's a lot of implants or one implant, There's this satisfaction both in us and in the patients of seeing everything nice and pretty and functioning. From that step further, like how long is your dental implant gonna last, is a question that depends solely upon how well you take care of it.